Welcome to the Rehab Links Secrets to Success podcast. I'm Lisa Chase, your host, and today we have two special guests, actually, Dr. Abby Torrance and little Dallas.
Yes, he
Oh,
decided that this was a better place to take a nap than in his bassinet. So we wanted to make sure we got through it all.
I love it. It's great. Well, we welcome both of you.
Thank
So,
you.
so Dr. Torrance has a great background. She's a chiropractor and specializing in sports medicine and orthopedics. And you have a company called Love Health, which I really want to hear more about. I was actually talking to your husband last night, the other Dr. Torrance, and he was telling me a bit more about it. So I'd love to hear more about that. And, you teach with rock tape and, you're a super fit, super mom of two. And, we've watched you over the years with, doing Pilates and staying so active. And I know you're super active in the community and helping lots of athletes, from CrossFitters to runners, to working some Olympic competitions. So let's just jump in so you can tell our listeners a little bit about your journey and what you're doing in the community here in St. Pete.
Well, thank you. That's such a nice introduction. Sometimes you forget what you do until someone summarizes it, correct? And yours would take like 15 minutes to get through.
Oh.
But yeah, so Love Health started in actually Philadelphia, city of brotherly love. And we, within just a couple months branched out down in Florida because we were actually going back and forth between Philadelphia and St. Pete at the time. So that's where the name comes from. And the business originated as a collaboration between the other Dr. Torrance and I, where he was doing a lot of functional medicine, personalized medicine, and then I was doing the personalized, more rehabilitative medicine. And it was just a great, team synergy there, because as we know, it's the whole person that's involved in our health. So that started back in 2016, and we have been in the local community since 2017. So that is kind of how long we've been here in St. Pete doing what we do. And in terms of what our practice looks like, the primary arm of the practice is what I do, which is the movement-based medicine. And those are, I call it kind of like a boutique therapy session. It's not your typical go to a chiropractor, you spend 5 minutes there and you get adjusted and you leave. I spend an hour with every patient, really digging into the root cause of their problem. So if it's someone comes in with wrist pain or foot pain or back pain, I'm looking at the entire body from big toe to skull and figuring out the combination of factors that are leading into that structurally, as well as considering the factors that are biochemical or emotional and how they all play together. So that is kind of the cliff notes of how we work up a patient.
Yeah. And, it's so important. And, it back to normal, same thing, right? We're really, looking at that whole person. It's just so important. I mean, oftentimes patients come in and they do have multiple things, right? And to be able to have a practitioner that can really look at the whole person and address the whole person, I think is just, so critical. So it's great to know, that you are doing that in the community for sure.
Thank you. Thank you. And it never ceases to amaze me, the cases that pop up. They call it practice for a reason, because even us who have been in the field for, 10, 20, 30 years have cases that continue to surprise us or be interesting. Like I recently had someone with a lot of musculoskeletal symptoms, but it was really heightened by anxiety and stress and kind of a grief event in their life, just changing to a new normal. And they were very much musculoskeletal, but triggered by, neuroemotional causes. And it never surprises you how dynamic the human subject is.
Yeah, and how things come out in the musculoskeletal system, right? I mean, whether it be something organ-based, inflammatory-based, or emotional-based, the patient that presents in front of us, it's oftentimes through the musculoskeletal system that they become symptomatic, but not necessarily the root cause. So Yeah, that is so true. So tell us a little bit about your background in sports and in CrossFit. I know you are an avid
Yeah.
athlete, and both you and Ron have done a lot of CrossFit. So tell us a little bit about that and how you help that community.
That was a really amazing opportunity in my career that I think that's where I say I grew up as a clinician. I was kind of, went out into the field, and as chiropractors, we don't have as much of a residency as, physicians do or physical therapists do. So a lot of our learning is on the job training after you're released from school. I had the benefit, like I had all these, like, what do they say? Luck is the meeting point of preparation and opportunity.
Yes.
And I lucked out so many times in my career with like how I was able to get some really unique experiences. So I think the first one was in actually in school. We have all these credits we have to finish. It's kind of like our clinical residency.
Yeah.
And I just didn't see myself sitting in downtown Dallas, seeing people I'm recruiting from my running group the whole way through school, which was great, and that actually built up my first practice. But I wanted to do something more sports oriented. So somehow I was selected early in an early semester to go to Bogota, Colombia and work with the Colombian Olympic Committee.
I saw that.
So it was really, really a neat experience to be able to trade in kind of a mundane way of finishing your clinical requirements and doing something really neat, like, on the side of, sidelines and fields and seeing injuries you wouldn't expect, dislocated toes and, things that are more emergent to things that are
Yes.
like an acute low back,
Right.
and things like that. Because in clinic, a lot of times you're kind of manufacturing your cases and just getting friends and family to come in and, so it was real life experience. And in a community I didn't even know that I wanted to be a part of. So I went to chiropractic school wanting to be what I call a hippie doctor. I wanted to do herbs and nutrition and, more on the alternative side, but I fell in love with sports in that internship with the Olympic Committee. And so that was the beginning of my love affair with sports. And
Yeah.
then in my second year in practice, that was the company I worked for called Airrosti, which had a really strong relationship with the CrossFit Games.
Yeah.
So pretty quickly, I was able to jump right into a team that was treating on site at CrossFit Regionals when there used to be regionals and the CrossFit Games. So that was, I was probably 3-4 years in practice at this point, and I'm shipped off to California to see professional athletes every 20 minutes and keep them tuned up in the most physically demanding, 4 days of their professional careers.
Yeah.
So, that was a really awesome opportunity that, formulated how I see my patients and see acute sports injuries. And so that was another lucky opportunity.
Yeah, and it is it's a very different experience, and a different mindset, when you're working with those high level athletes, and we can certainly take much of that, as I do, right, to our patients. But talk a little bit about, we're gonna talk more about getting great clinical outcomes, but I'm interested in your perspective for an athlete. Like, what is it about that professional athlete and that mindset that when you're approaching them allows you to get those great clinical outcomes?
Professional sports, as you know, and working with tennis is extremely mental. I always say I'd be a terrible baseball player as much as I love baseball, because I'm like, how do they forget the pitch before that was terrible? How do they forget that that when they had a really terrible strike where they swung at the wrong pitch? The amnesia you have to have from moment to moment, always amazes me. So I would say I have a profound respect for the mental side of being a
Yes.
professional athlete. It's as important as the physical. So I think creating an alliance with the athlete is number one most important. Verifying that you see how important this sport and this event is for them. Your goal is not to sideline them and tell them they'll never play that sport again. They need to stop
Yes.
doing this. They're hurting themselves. I'll tell someone who's in the middle of like an activity or has an event that they're trying to do, I'm like, you're not going to hurt it more, by doing this event, but you're definitely going to delay your overall healing. I'm a pit crew. I'm here to, screw that bolt a little tighter, so that you can do that next event. So we're not looking for a pain-free resolution that I like to promise my general population patients,
Right.
but in the sports arena, you have to meet them where they are. I'll be like, hey, let's get through October because that's the crunch for your sport, and then we'll focus on healing after this. So whether it's, you know, a high school runner that is trying to get those last, you know, senior year races in before they commit to their college, you know, I have those experiences, or, you know, a professional volleyball player that has to play next weekend. You just have to see what their goal is and tell them how you're going to get them through that, and let them know it's not going to feel great, but how do we help you perform?
Yeah, and I love how you said meet the athlete where they're at. I mean, I think that is just so critical. And, you know, I think understanding the athlete mentality and, you know, partnering with the athlete and oftentimes their entire team. When you're talking about professional athletes, it's coaches, it's parents, it's sometimes it's media, it's sponsors, it's lots of different factors that are playing into the stressors or the demands that an athlete has to, you know, undergo that maybe the general population is not having to, you know, consider. They might have to be considering other things, but yeah, I think those things are all really critical. So now I know that you go around teaching with rock tape. And so tell us a little bit about that and how you utilize that with your patients.
And we spoke a little bit about this at our last happy hour, but I didn't get to finish the story, you know, because we always have this little guy who demands our attention. So I think one of the coolest things that we share is that we both did the original kinesio text taping course back in 2008. I remember I got like the last spot and I was like, oh my gosh, I'm on the cutting edge of this medical technology. And it is an awesome tool. It is a very cool tool, the kinesiology tape, which is, you know, the way I teach that is like, okay, it's just like you say toilet tissue and you say cottonelle. Kinesiology tape is the overall discipline, and like rock tape, KT tape are the brands. So that's how you can discern what rock tape is and how it's different than KT tape.
Right.
And what sets them apart is really what comprises the tape, which is how expensive the cotton is, how nice the nylon is, how their adhesive is formulated, how much stretch is on the tape. So that's what sets the brands apart. I just like to give that little plug so people know what kinesiology tape entails.
I think that's
and it is because I love rock tape, but a lot of people love various other types of tape. Sure. So I went to kinesiology tech's course and I was like, okay, I am now the queen of taping. I'm the only one in my class that has done this. I was still a student at the time. And I felt very excited about that. But then I needed some more hours, maybe 5 years later, you know, it's like, so yeah, we're like 2012 at this point. And I went to a rock tape course, and I intended, because I was the queen of taping, of course, to just sit in the back and catch up on notes and zone out and get my hours. But then I was like, I'd hear him like introduce a study. And I was like, okay, that's different than what I learned. And then there was another study. So they had reframed what the tenets of tape are and how we think it works based on the science. So kinesiology tape kind of was more theoretical, and so they brought literature to the table. And so I like put my computer away and then like was just absorbed. And from that lunchtime on, I started to stalk that instructor and be like, I want to instruct this. Like, I believe in this because I love the tape and I love what you're saying. And so again, somehow I spoke to the right people and became friends with the right people, and they saw some kind of potential in me to be an instructor, and they let me join the team. So I was actually the only female instructor for a couple years back in the early 2010s, I guess. And then the team grew from there. So the company that I worked for allowed me to deliver the rock tape education internally to all of our new hires, because I said, we practice in an evidence-based way, and this is the best evidence that we have. And they actually update their education annually with the most recent literature.
Oh, that's great. Yeah, I didn't know all the history behind, you know, rock tape. We've been talking about having you come and instruct, you know, team. So yeah, so that's good to know. Now for the listeners, you know, I know that kinesio has been around for a while, and it's kind of first introduced on the scenes, right, of the Olympics, right? And everybody saw the volleyball players were taped, and I think some of the swimmers. And so that really
Mm-hmm.
gained interest, and it kind of took off from there. But some of our listeners may not really understand, like, what does the tape do? How does it help somebody? So maybe speak to that
And
for a minute.
absolutely. And that's one of my favorite things to talk about. Even though Rock Tape has probably about 8 to 10 courses now, basic taping where we teach this is still my number one favorite. So as I mentioned quickly, I know I'm talking like an auctioneer about some of this stuff, is that the tape has 4 major ingredients. Cotton, that's basically what the tape is made out of. Nylon has a one directional stretch in the lengthwise direction. The third ingredient is the acrylic adhesive, so it's not latex, so any latex allergies are safe. And then the stretch that's applied on the tape in the factory. So those are the 4 components that make up the tape. And stretch is actually, most noteworthy because that's what allows it, when you take it off the paper and apply it onto the skin, it creates what we call paper off tension. Since we have that unidirectional nylon stretch, it recoils back to the center of the piece of tape and creates every effect that we're looking for. And the 3 major effects are pain reduction, decompression, or what we call fluid dynamics of swelling or bruising, and third is neurosensory, or kind of like proprioception. So the stretch in the tape and the fact that it applies directly to the skin is the method by which we're able to attack pain, reduce pain on an area, decrease inflammation in a local area, and also help the brain identify with a kind of sleepy area of the body, if you will.
Yeah, that's great. I think that's really helpful. And I mean, and I've been, was exposed when I was on the tour to many different types of tape, from the kinesio to the athletic tape, which is very different in how it's made and its purpose, and stabilizing joints and things like that. So I think tape in so many different ways can be hugely helpful as an adjunct tool to help us get great outcomes. So that would lead us into the next, section, which is you sharing some of your, tips on how you get great outcomes.
It's a joke that I say, and it kind of dovetails off what I said about building an alliance with an athlete. So this is general population or an athlete. The joke I say has some truth to it, but I'm like, I'm 20% good clinically, 80% likable, So I think that really, really listening and connecting and being there with your patients is a huge component of it. I mean, I like to do fun little cosmetic things like my eyelashes. And I remember quitting an eyelash girl because I simply didn't like the conversation. So I think that connection is a huge tenet that I rely upon for clinical outcomes, because then I get trust, so in connection comes trust, and I mean, I have, people older than my father asking me how to navigate a life-changing knee injury, and I'm like, wait, it's, how are you putting trust in me, someone who's young enough to be your daughter and guide your care? So that is a huge part of how I practice, is building rapport and trust. And then, I think I really consider, and I don't mean to like toot my own horn, but I feel like through my experience with sports and the people I've aligned myself with, both in the medical community, physical therapy, athletic training, I've really opened myself to a diverse community of clinicians. I feel like through that, I've become a pretty good diagnostician. So I feel like the accuracy, like if that, that gentleman I was thinking of when I said the man older than my father, he came in with knee pain and it was no onset, it was just kind of insidious. It kept on swelling, pain would come and go with, things. And I was like, that sounds like you have what we would call bone marrow edema, just through my practice, building a repertoire of cases, you don't have anything that points to a meniscal injury. You didn't do anything except walk to your favorite lunch spot. There was no rotational injury. So, because of his case, I felt like, I was like, I think we should get an MRI, but I'm 80% certain that you have this. And it was that, so that also builds the trust when I'm like, this is my hypothesis. If I had MRI vision, it would cut to the chase a lot better. But based on my experience with the way your swelling is, I think it's this. So, and getting an MRI to confirm it. But also in that rapport building, I'm like, we're going to get an MRI, but my question is, then what? we don't just get our MRIs for fun to see what's inside. We would see a lot of stuff we don't want to see. I'm like, we have to commit to each other that if it's something on my differential list, we have another step to do something about it.
Right. Yeah.
So, in his case, there is an interventional procedure through my husband's practice, Regenix, that does extremely well with that.
Yeah.
So that is kind of how I mentally worked up that case, and I'm guiding him to a good clinical outcome. And the key is sometimes it's not with me. I've told people, I'm like, go see, Lisa Chase. She has stuff that I don't have that your injury needs. I'm a four walls, thumbs, and emollient kind of girl. I don't have a bunch of, things that can get deeper into the tissue. I don't use needles, so I love having colleagues that have things that I don't do, because I'm really confident in what I do, and I want people to get the best outcomes with someone else in a way that I can't help them.
Yeah, I think that's so true. I think, I always say the mystery's in the history. So listening and asking the right questions, I think, is really critical. And then, 10,000 or more hours make a difference, so,
Yeah.
To those new clinicians that are out there, you just have to kind of build your base, surround yourself with people that I always say that are better than you, that know more than you, or, are where you want to go, right? And learn from them, because it is that experience, and through working with other clinicians and experiencing different cases, that you start to develop that repertoire and understanding. When you see certain things, either and expect how it's going to turn out when you treat it,
Mm-hmm.
or the signs and symptoms are, leading you down a path that, okay, this is what I need, to do, or, this is how I'm going to identify it. And then having colleagues in the community, I think, is, really critical. I mean, I do a ton of work, with Ron and vice versa. And, really trying to do what's best for the patient, and find people in the community that are really good, clinicians, and want to have that, that partnership to help patients get well. So, yeah.
Absolutely.
Right.
And I'm grateful to have you. That's what I love.
And vice versa. I know.
And I don't know if you experience this, this is something that just kind of struck with me, and you may have experiences going from the tour back to more, you work with a lot of athletes now, but you have general population as well.
Yeah.
Because I was sports, and then I was basically administration. So I had like a 5-year gap where I was like a clinical trainer, and I did a lot of teaching and more like super part-time practice. And then I went back into full-time practice. And I remember almost, I was like 6 years into practice, not starting over, but I had to build new case knowledge, because going from primarily athletes to the general population, I was like, this is so different. We're not dealing with turf toe, we're dealing with a disc that's manifesting as plantar fasciitis, and it's different.
Oh my God, that is so true. I mean, I remember after being 10 years on the tour and working with that particular population, and then coming back to the general population, it's like, not only was it a disc, but it was like heart disease, diabetes, all these comorbidities and other things that many of our athletes didn't have, that you have to take into consideration, the healing and inflammation, and there just a variety of things. So yes, I mean, I think, we kind of ebb and flow and go through, different periods as we're, I think, going through our career. And even when I went on to the tour, I went from a general population, had worked with athletes, but had not worked on that particular level. And especially in that acute care, like you were saying, like they get hurt on court, and you're there, and you have to figure out, okay, is it safe for them to continue? Can you tape? Can you get them through the match? And that's very different than, like you said, what walks in our door when we're in the clinic, right? It's not necessarily those acute, injuries with those kind of demands. So, but hey, that I love that, and it keeps me challenged, and constantly, I think, keeps you learning and growing, which is really, I think, important as a clinician. And to get, great outcomes, I think you have to be curious and, want to learn more, for sure. And actually, Ron and I were talking about that. He was talking about being curious and how important that is. Yeah. So yeah,
I love that.
Yeah. Okay, so how about, I know that, between obviously, your athletes, your patients, and certainly as an instructor, you bring, some natural gifts to those populations. So maybe talk a little bit about any tips that you think your particular audience really resonates when they're working directly with you.
So I would say maybe, in the technique that I have been mostly trained in, it's not technically a technique. It's just, it's fascial based, we'll just call it fascial therapy. So I feel like that it is pretty unique in the sense that it's like, I always tell people, I'm like, it's slow, it's deep, and it's boring, but it's kind of what we have to do. And a lot of practitioners like don't have the patience or the desire to beat up their hands to do that, so I actually really enjoy that, even though I have tools, like a blade or a Graston tool, which is like a metal tool, which I will use. I feel so much more connected, when I'm just hands on skin and, do that way. So I would say just the way that the manual approach has become so second nature to me, I'll just chit chat and have a conversation about, someone who's a Disney enthusiast, while I'm doing my manual therapy because it's so like second nature to me at that
Yes.
point. So I would say in the realm of therapy, that is kind of a unique gift. The desire, willingness, and ability to do that nature of tissue work.
Yeah, yeah, for sure. Like you did, it is funny how after you start to master a skill, that you just are doing it and not even thinking about, how, where your hand needs to be, exactly the orientation of the joint. Like you become one almost with the tissue. So
Mm-hmm.
I can appreciate that for sure. Yeah.
Yeah, actually, my first year of practice, I almost like don't talk about it on purpose because it was formative, but it was not a great experience. It was like an associateship. I worked with another doctor who I hoped would mentor me, and I think she expected me to just come in like a dynamo, and I very much was not a dynamo. I went from, Colombia working with professional athletes to clinic where I was basically learning general population,
Right.
and yeah, so I remember being on, and I don't know if YouTube was back then, whatever online videos I could find, like really massage therapy, because I hadn't learned my
Yeah,
fascial techniques yet. I was like
sure.
trying to figure out like, okay, how do I touch like, Terry's minor? Like, I remember trying to do that, my first year in practice because I felt so, out of touch with like how to be effective in those arenas. So it's kind of funny to feel so competent now. And I remember considering leaving the field altogether, at that
Hmm.
point, because it was a challenging feeling to be so green.
Yeah, I know. I remember feeling that way when I went on to the tour because I had been practicing 10 years and maybe, well, I know, you said you were a student kind of coming out of school when you did the training, but I had been in practice for 10 years and I felt like, okay, I know what I'm doing. I feel pretty skilled. And then you go into this completely different arena and you feel like a fish out of water. You're like, oh my God, do I know anything?
Hmm.
It's like, yeah, you do, but it's different. And they're new skills that you have to learn. So but again, I think it's great to be constantly challenged and never settling, for just the status quo.
Absolutely agree.
Well, excellent. So is there anything else of value that you would like to offer to our listeners?
I think, well, on my maternity leave, this time I'm kind of 2 months into my 3 months where I'm focusing on what I actually told my husband this morning is harder than the board exam, which is mastering parenting. That is like, I didn't get the notes for that. There's some days that are such a challenge. I'm like, I would rather take part 4 of my boards again than, like try and figure out this toddler situation. So I mentioned at the beginning that we had a functional medicine arm to our, practice when the inception, happened in 2016. But my
Yeah.
husband then became, engulfed in Regenix, and that time, fell away. So I actually have set it as a personal goal on maternity leave to reinstate my ability to, very easily help my patients get blood labs that they're looking for to kind of round out that whole picture. So that's kind of an exciting arm, that I've always stayed plugged in with. Like that's an arena that, like I said, I always stay curious. I'm always researching, different biochemistry based on labs. Cause I'm sure you have patients bring in labs to you and be like, what does this mean?
Yes.
Cause they
Oh
go to their
yeah.
primary and they're like, everything's normal. And I'm like, well, yes, it's not red,
Yeah.
but you're like low normal or high
But
normal,
that's
and that
right.
affects your ability to manage pain and things. So since I'm a chiropractor, thankfully my license has, some ability to create, basic blood lab orders. So I wanted to make an easy, economical way for my patients to get those blood labs. And so I found a way to do that. And I'm kind of reinvigorating that side of the practice when I return
Nice.
in November. Yeah.
Yeah, well, that it's so great to be able to have that, right within your practice. And, you're right, what a general physician may look at, right? They're looking at, okay, yeah, this looks normal. But when you're looking at it more from a functional medicine perspective, the norms are different, and what you're really wanting to target can be different and really make a difference in somebody's overall health, ability to get out of pain, or even, really help that healing process. So that's great and excited
and
for
and
that.
there's a huge like chasm between the person who can order the labs, because I always tell people, I'm like, I don't really have the time or ability to get on a call with you weekly for you to tell me like that, what your health coach. Essentially, I'm not a health
Sure.
coach. I can
Right.
help you find the information, but then I know in your practice you have an arm of health coaching. It gives me the
Yes.
ability to refer to health coaching. So I actually find health coaches the hardest to refer to, because
Yes.
it's like, okay, what will they be doing? It's like, okay, you have, your TSH is high because this might be happening in this hormonal matrix.
Yeah.
Okay, we know that. I can help you see that, but this person can help you on the daily basis, you know make that more normalized through nutrition and other factors.
Yes. And like you mentioned,
That's
we
why
have
I like to
Jillian.
refer.
Yes, exactly. And that's where we can work closely together. So Jillian's our functional nutritional therapist, and she's fantastic at really pulling all those pieces together, whether it be lifestyle, whether it be, some supplements and nutrition, and how you marry those things to improve, the different things that come up in labs and those kinds of testing. So good. So we'll be collaborating more on that. That'll be
Yes.
great.
Yeah.
Well, awesome. Well, this was great to have you and little Dallas. He looks like he's out now.
Yes, he did great. He got an A+. I was
He
like, listen,
did.
buddy, we
Good
gotta stay
job.
asleep so that we can have a good conversation. So he did his job.
Yeah, he did an awesome job. Well, why don't you tell our listeners how they can find you? I will put some of all the information you sent me in our show notes, but just best way that they can reach out to you if they'd like.
Yes, so my Instagram is Mrs. MRS Love Health Doc. And just forewarning, it's a lot more lifestyle focused, but it's just a way, I use my Instagram as a way to be authentic, because I didn't find it to be authentic for me to demonstrate a stretch. I'm like, I want to show you what I'm doing every day, whether it's a run with my kids. And so it's more just lifestyle content if you're interested with that. And then my website is wearelovehealth.com. And you can kind of check out what we do. There's online scheduling available. And that is, those are the two major places.
Well, I really appreciate you taking the time, especially with your busy children running around, and love having you in our community. And you're always an inspiration, with, how you keep your family and you keep, your health at the forefront of everything, that you do and that Ron does. I think you guys are great examples, for other people in the community. So thanks for all you do.
Thank you for saying that. Well, I appreciate you and look forward to collaborating more.
Awesome. Well, until next time, keep getting great
All right.
outcomes.
All right. Bye.
Bye.